Hi, I'm Joanna Tennell, and I'm doing Biofeedback. It's a case series study on biofeedback cycling training to improve locomotion with 153 chronic stroke patients. And level of evidence is 4 because it's a case series study. And what they did was they would get on a cycling ergometer, which would be hooked up to this is called a TheraLive system, motorized cycler ergometer, and it was then, while the person was pedaling, and I'll go through the protocol in a minute, while the person was cycling, this cycling ergometer, or one similar to this, not exactly, would be hooked to a master computer, and what that would do is it would take the signals from that with a sampling frequency of 200 hertz and calculate after each revolution of the cycling, and then determine the biofeedback indices, and then it would transfer it to another computer, which would then show it on a screen to the patient. So while they're cycling, they can get feedback on how much force they were putting with each limb. So their affected side normally doesn't produce as much force, and they overcompensate with the unaffected limb. So the purpose of this was to try to get equal balance between force production on both limbs, which in turn will help with locomotion and gait otherwise. So the protocols used were 3 days a week for 2 weeks, and a total of 6 sessions, and each session was 14 minutes. They would do 1 minute of passive cycling, which is, the passive cycling was constant value of the speed at 30 reps per minute. And then they do 2 minutes of voluntary cycling without visual biofeedback, 8 minutes of voluntary cycling with visual feedback. And voluntary cycling is at however they feel comfortable doing. Then they go back to the 1 minute passive cycling at 30 reps per minute, and then 2 minutes of voluntary cycling without visual biofeedback. And so over this study, they actually broke it down into 3 other categories of people, 3 different groups, and did another intervention of the same thing. And the results they got for this entire study was that it does help improve with locomotion in chronic stroke patients, and that it would be better to actually have a bigger group and do more testing on it to see, and maybe like a longer time period than just 6 visits. And so that would be best to try it out as that. But it did have some kind of benefits. And I would actually use this protocol in mine because with patients in general, especially like stroke patients, we normally warm them up on something. So if we did this protocol, which only takes 14 minutes each session, say 2 to 3 times a week for a period of, a month or so, then that's a longer time period. And also it's a warm-up exercise, so it's not taken away from any other treatment. So that, along with other exercise for strengthening and balance and everything that they're lacking in, would also help. So I only see positives in this with doing this exercise, and then it helps, like it says, it helps with locomotion. So I don't see any downsides to that, and it's really cheap and effective. So I would definitely use this, and hope you guys would too.